Welcome to our discussion on high-yield PYQs for NEET PG, as we explore spinothalamic pitfalls and clinical insights.
Thank you for having me. I am excited to share details about the neuroanatomy and exam strategies for these challenging questions.
Let us begin with a question about a patient experiencing burning pain and temperature loss on one side of the body.
In this case, the lesion is located in the left lateral spinothalamic tract at the T8 level, given the contralateral pattern of pain and temperature loss.
How does the handoff of sensory information explain a right-sided deficit from a left-sided lesion?
Pain and temperature fibers decussate soon after entering the spinal cord, thereby resulting in contralateral loss in the presence of a lesion.
Can you explain why the dorsal column is not affected in such scenarios?
The dorsal column transmits proprioception and fine touch that remain intact because they ascend ipsilaterally before crossing in the medulla.
Moving on to syringomyelia, what is the classic pattern of sensory loss we observe in this condition?
Syringomyelia typically presents with a cape-like distribution of sensory loss affecting the shoulders and upper arms.
How does the expansion of the central canal lead to this distinctive pattern?
The central canal expansion interrupts decussating spinothalamic fibers at that segment, causing bilateral loss in the cape-like region.
What common pitfalls should students avoid when working through these types of questions?
One common error is revering the sides by failing to account for early decussation in the spinothalamic pathway.
What rollout strategy would you recommend for approaching spinothalamic MCQs effectively?
I suggest identifying the sensory modality first, then locating the site of decussation, and finally mapping the side of deficit to the lesion.
Are there any issues related to confusing tract names in these exam questions?
Yes, distractors often mix up lateral and anterior tract names, so careful reading of each option is essential.
What are your thoughts on the use of a rapid-fire true-false drill in reinforcing these concepts?
Rapid-fire drills serve as an excellent method to test our immediate recall of neuroanatomical principles and common exam pitfalls.
Could you explain the mnemonic love pain today used in the session?
Love pain today reminds us that the lateral tract is responsible for pain and temperature, while the anterior tract carries touch signals.
How critical is understanding dermatome maps in the context of these clinical questions?
A firm grasp of dermatome distributions is crucial to avoid misinterpretation of lesion levels, especially when precise localization is required.
Beyond sensory pathways, what other aspects of neuroanatomy are important for these PYQs?
Knowing the crossing patterns of various fiber tracts, including motor pathways, adds a layer of understanding that can differentiate subtle clinical presentations.
Could you share one additional tip to help students avoid common traps on exam day?
Always correlate the clinical presentation with the known anatomy and verify whether the sensory deficits match the expected patterns of decussation.
This conversation has provided a clear walkthrough that ties clinical scenarios with core neuroanatomical concepts.
I hope our discussion encourages students to adopt a systematic approach when tackling these challenging PYQs.
Today, we have dissected real question strategies and pitfalls that often cause confusion in exam settings.
Our focus has been on understanding the why behind each option so that exam day decisions become more intuitive.
The discussion has emphasized the importance of attention to detail in areas such as the level of lesion and side of deficit.
Correct analysis requires careful mapping of the pathway and crossing patterns, ensuring that each piece of information is correctly interpreted.
We have explored strategies from rollout techniques to the use of helpful mnemonics.
These techniques are designed to reinforce memory and improve decision-making under exam pressure.
I trust that this in-depth dialogue has clarified many aspects of spinothalamic pathways and clinical reasoning.
My aim has been to present these topics clearly so that students can build confidence through thorough understanding.
Our conversation today has provided valuable insights into tackling PYQs with precision and logical analysis.
I hope that these insights prove beneficial in your preparation as you work toward exam success. Ending. Thank you for joining our episode on spinothalamic pitfalls and PYQs. We wish you all the best in your exam preparation and hope you carry these strategies into your study sessions. Goodbye and keep your reasoning sharp.